Hey y'all, I'm Tara Shaver with AARP's Office of Volunteer Engagement, and today we're keeping it real on the roost, and we are talking about partnerships. And today I'm here with Rebecca Chaplin, who is with the North Carolina office, and two of her volunteer partners, Bob Tomasulo and Alan Briggs. And these guys are also from the mountain region. So if you listened to our last episode, we are doing all things mountainous on the roost. And Rebecca is going to just kick us off and talk a little bit um, about what we're talking about. Go ahead, Rebecca.
Sure thing. Well, I mean, relationships are kind of the cornerstone for everything that we do, and it's relationships within our team, but also the relationships in the community. 3 years ago, our team set out on a strategic plan, and of that plan of 5 goals, partnerships was one of the strong goals: to develop partnerships, to improve the partnerships. It was also part of our communication plan. We recognized that the best way to get people to events was through our partners. So through all of this, we already had like a really extensive partnership list, and Bob was really the spearheader of organizing that information and bringing people together around it. So we hit the pandemic, right? And everything goes virtual. And the question arises for us and for me: what makes us relevant? People could watch a webinar anywhere. So why are we here? And it becomes where we are relevant is through those relationships that we've been cultivating either in our own lives or through our team over the past several years. So also we have assumptions about what our partners were going through, but we decided that, what would happen if we actually just made some phone calls? We had about 62 partners on our list, and so the team broke those up, and I think we're at approximately 30 of those partners have been contacted, but the team developed a list of questions so that we could get some consistent information and really get a genuine pulse check of what's going on in our community.
That's great. And it's also nice to hear where you are in the process of going through that list. I think sometimes when folks hear about, oh, we have this many partners, and they think you just did it all overnight or in a week or something, and to know that it really is a process, and we're learning all the time. I'm sure you guys ever find that process each time you've made a call. So Bob, let's get to know the team a little bit better. Bob, tell us a little bit about how you found out about volunteering with AARP and how you focus your energy on the team.
Okay. Well, I blame Rebecca for that. Um, Rebecca and I have worked together almost 10 years now, probably. So we knew each other before AARP. So when she went to work for AARP, she contacted me and asked if I'd be interested in volunteering. Foolishly, I said yes. And I've been involved ever since. It's 4.5 years now, I think we're going into. But it's been a very positive experience for me. I've volunteered over the years with a lot of different groups, and this is one of my favorites. It's well organized, and I like that. And there's lots of information available. The resources are just tremendous, which is a really big help. You don't have to start from scratch with everything. There's a lot of out there you can build on and tailor it to your local situation.
It always makes me happy to hear that we're a favorite. It never gets old. I've heard that over the years, and it always makes me smile. So Alan, what about you? How are you introduced to AARP, and what kinds of things do you do?
Well, actually, I'm an old friend of Lisa Riegel, who is the advocacy person for the state chapter, the North Carolina chapter of AARP. And she called. I retired a couple of years ago. Rebecca loves to label me as a lobbyist, but I did wear other hats. But I was in public policy and advocacy for most of my career. And I thought I was retiring from that and getting away from it. And then my younger daughter, who also lives in DC, was telling me how great AARP's national advocacy programs were. And she said, yeah, you ought to, keep a hand in it. So I told Lisa I would help with their advocacy and I dipped my toes in that water. And Rebecca, I'm not sure exactly where you and I connected, but as Bob said, once you meet Rebecca, there's no going back. We hit it off right from the beginning. We have no presence in the very rural counties that I'm working in now. And we decided that yeah, it would be kind of fun. I was ready to stay away from Raleigh a little more and get boots on the ground here in Ashe and Watauga counties. So we started, I guess about a year ago, beginning to do outreach, trying to recruit other volunteers here, and started planning programs for this year to really develop a presence up here. And we've already had to cancel 8 so far this year and can't do any more. So it's been a challenge, as the topic says, for now, how do we stay engaged with people and keep a presence in the community and still let them know AARP is here and we care.
Gosh, it's been so heartbreaking to cancel such good work. And I know we talked a little bit about this as we were chatting. Rebecca, you were like, we had such a great year planned and we're now replanning it. So we'll just put those, those plans on a shelf and revitalize them in a year or two. It'll be the work will be done. That'll be a light year where everybody will, like, I don't know, drink mojitos and spend a lot of time in their lawn chairs because all the pre-work will be done. So Bob, tell me, what is your role with the Mountain Regions team and how does it relate to partnership development?
Okay, well, to relate it to partnership development, my role actually is pretty broad. It's whatever Rebecca needs me to do. But but with the partnership thing, I kind of jumped on that because having been involved in the community for 12 years now, since I lived in North Carolina, I was familiar with a lot of the organizations, nonprofits, and the people involved in those. So it kind of opened a door for me representing AARP. I already had those connections and I just had to build on them. And that's why I took on the partnership challenge, because I thought that was something that was a natural fit for me and something I was comfortable with and could run with it.
That's great. Thank you. And so, Rebecca, how did the team decide to put this list to work during the COVID crisis?
It really came from our localized communications plan. That was another task that we started to really get into during COVID, because it was something that required a lot of think time, but it didn't require physical presence. So when fleshing that out, we just realized this is the next step, is to formalize a process for reaching out to our partners.
Nice. And then, so Alan, which partners did you interview?
Well, I want to just quickly emphasize what Rebecca said. I think one of the greatest things that we came across was not trying to come in with a solution and then see where it would fit, but by reaching out to the partners, one of the key elements of those conversations was, how have you responded and what's working and what's not working, and where could AARP make a difference? So among the various partners I was working with here was Ashe Services for Aging. And they have a broad spectrum of programs, including senior housing, assisted living, food service, congregant feeding services, meals to go, an intergenerational child care center. Pretty amazing for such a small county. And in talking with Patricia Calloway, their director, and asking that question of how you've adjusted and so on, she was thinking through it with us too. And she said, staff retention, staff morale is really challenging, because these people are in difficult situations. They're putting themselves at risk. Their families children are at home. They have those needs. They're juggling all of that. So we began to toy with the idea of, how do we do something to show appreciation for these workers? And we focused in on the in-home aides. These folks are independent. They're out there. No one really knows about them except the families or individuals, the seniors they're serving. And they were really feeling discouraged. They felt unappreciated, unrecognized, un-everything. So I'll pause there, because it gets to be quite a tale, and I don't know how much you want me to go into. Once we started wanting to help,
Yeah.
the iterations of, the workers wanted T-shirts so they would be identified. They said, so people would recognize us as, hey, this is what you do, cool. But while we were in discussions, they found another funder to do T-shirts. So Rebecca and I particularly, and I, being again, and our county was hard hit, I was thinking, what can we do with a local business that's hurting, so we could have some money in the local economy, but also do something nice for these folks. And we talked about maybe meal cards or whatever, but you know, that we could, and so basically it came down to Rebecca and I love chocolate. And so I talked to one of our local, we have a Paris-trained chocolatier who lives in Ashdown.
Ooh.
So I said, well, let me call Suzanne and see, maybe we could do chocolates, because that's something they'd never do for themselves. Well, she was really excited, really wanted to help, but she had just lost kitchen access to the commercial kitchen where she worked. She doesn't have a brick and mortar facility, and the local commercial kitchen, to prepare chocolate, you have to have 24 hours for them to sit and crystallize. So they wanted to charge her by the hour just to have her chocolate sit. So we went back to Ash Services and said, you guys are, you know, your kitchen's closed now. What about if we let Suzanne come into the kitchen? Well, just that week, they started doing meals to go again. We're reopening their kitchen. So we talked a little more, and I said, well, what days? And they said, well, we're only doing it Monday through Friday. And I said, well, what time do you get through on Friday? And she said, oh, we're done by about 4 o'clock. And I said, when do you start back? Monday morning early. So I thought, well, there's 2 24-hour shifts. So go back to Suzanne, do you think that might work? And so after playing around with the health and safety rules and so on, now Suzanne is, you know, paying a little bit to use their kitchen on the weekend, so it's a little income for Ash Services, and she gave us a deal because we partnered. So a couple of weeks ago, we were able to do a nice card and a presentation to the 50 in-home aides who came for their paycheck on June 15th, and they got a nice little card from AARP and a wonderful box of 6 gourmet bonbon chocolates.
Oh my gosh, that I was having chills as you said, you know, all these connections that you're making, and also uh, mm, the people who are not recognized, and how easy some of the things are that you just talked about, even the t-shirts, right? Like AARP knows how to buy t-shirts. So like if we had done that, that also would have been a natural thing for us to do. And it's almost an easy button. Like those kinds of things are almost effortless, right? Like we just know how to do it. So what a special gift to those folks too, to just, you know, we don't often buy ourselves anything gourmet. So to think about doing something that was custom made for them is so special. And just the whole way that that all came together is beautiful. And I think you were probably surprised by a lot of things within that, but how did this conversation go with other partners? Were there other kind of light bulbs that came up as you were talking to folks?
Well, this one actually was easy, I would say, Rebecca. I mean, I know you weren't with me on all those calls, but this need jumped out. So many of the other partners, at least that I'm working with, and Bob has had more of these, so he may have some observations with other groups, but so many of them, like some of our local conservation groups, we had planned hikes, for example, and they were just shut down. They're just canceling all their activities. So there wasn't much of a way to partner. We talked about virtual hikes or a wildflower walk, that kind of thing, but between the weather and the logistics, it's not that easy. So we're still going to explore that, but as convoluted as the story went, it really was easy here to identify a clear need. And although the path wasn't exactly straight, it was still clear what we could do and make a difference.
Yeah. So yes, Rebecca, go for it.
We're doing a good job of not talking over each other, so that I wanted to keep that going on. You know, what this highlights to me is that this was a job. It wasn't just one phone call. It opened up the door to relationships and, you know, several hours of work. And so to me, it speaks to what can happen when we check it out, and you could find a whole new path for AARP, a whole new role for a volunteer inside of that.
So that is we're mind melting this morning, Rebecca. That's where I was going next, is that what you've described for some people who may be listening or watching is not the typical way we would be involved in the community necessarily. Maybe occasionally during a special recognition month or something, but these are not the typical ways that we'd reach out to partners and lend a hand. And I just wanted to know, is that something, as you guys were chatting with folks and thinking through what you might do, did that come up? And, what were folks' feelings about that within the team, or even within your staff team, Rebecca? Have any of these conversations come up to say, like, should we be doing that? Or has everyone just said, we've not been in this place before, we're going to have to try some things?
It's bubbling up as a statewide initiative to really acknowledge and encourage frontline workers. So since then, just earlier this week, we had an ice cream social, a physically distanced ice cream social outside of a nursing home for the staff and residents where there's a high incidence of COVID. So it has opened up more and more of this type of way that we can really have an impact on organizations, show that we genuinely care, and also to support a local economy that's struggling right now.
Yeah, I think all of that you mentioned is so important. And gosh, Alan, I just can't even put my head around all the different ways that one organization was doing things that touch people really directly, and all of the different layers there, with also the people who are providing that service still having to deal with all this pandemic stuff within their own homes. And I think that is so cool that you guys have recognized it and embraced it. I'm in a couple of groups for nonprofits on Facebook and other places, and kind of followed this, and I'm hearing the same thing from different groups that are just saying, we're having a hard time keeping our staff kind of in the game, like their heads in the game, because of all the things that are also going on, and yet we still have these critical services to provide to the community. And so what a gift that you guys are bringing to these organizations, also that the leadership isn't having to just be the only people trying to think about how to keep their folks engaged and recognized and just uplifted during this time. So what do you think? You mentioned this, Rebecca, like you're starting to establish even some new relationships with the partners. What do you think the results will be, in helping you leverage AARP's work at post-COVID, post-pandemic?
Yeah, that's a good question. I think we're probably going to be just opening up new doors, and we don't necessarily know exactly what path that we'll be going down. But I see, particularly for advocacy and our nursing home related advocacy, that, and just advocacy in general for care, to be able to provide care for people. I see that there's this relationship could open up doors there. And, Bob also came up with this really interesting example of relationship development that I think will change the way that we engage, specifically in this case with the LGBTQ elder community.
Wonderful. So let's talk about that, Bob. Which partners did you interview, and what were some of the results that you had?
Well, one of the groups that I've been involved in, and actually Rebecca started this group when she was at the AAA, was the LGBT Elder Advocates. And it's been going along low-key, small group for several years. But recently they decided to merge with a larger organization called Blue Ridge Pride, which puts on the Gay Pride Festival here every year and does other big events for the community. And we hadn't really been doing much with them other than we'd have an AARP booth at the annual event and give out literature and free stuff and all that kind of good things that we don't do anymore, at least that way. So we needed to talk about what else can we do in this kind of environment that we can still engage with that community. So we set up a meeting with their board chair and their executive director, and talked about what they were thinking of doing. They've been revamping and upgrading their website for one thing, so it's more community friendly and can be used as a resource for people in the community. But Rebecca had also started a series of Facebook Live chats regarding livable communities. And I had participated in some of those, and I really thought that was a cool format. It's a 30-minute format live on Facebook. And I thought we could do the same thing with the LGBT community, put on a series of programs, bring in speakers or experts on one, whether it's on long-term care or nutrition or whatever the issue is, and tailor it to those communities. We have the programs already, we just got to tweak them. And they just jumped on it. They thought that was really great, and they want to participate in it. And hopefully by the end of July, we'll have it up and running. So that's a whole new program that we didn't even have before.
Yeah, that's great. Very cool. So what else, guys? Were there any other partners that really had something that you could tap into that just really caught the spirit and rolled with it?
I can think of one other one, we can't have all of our volunteers here, unfortunately, although I would love to. One of our volunteers is an Encore Entrepreneur Enthusiast, is her title that we've donned on her, and so she'd been working for a long time to develop a series of Encore Entrepreneur programs with partners, and so we reached out to one of those partners and talked about what could it look like to do something virtual. At first, she was like, I'm not doing this virtually. It's not going to appeal to the audience. But when the partner said, we really want you to do this, she stepped in, and that class starts Tuesday. It's a 5-week series for Encore entrepreneurs. So I feel like the interviews just keep opening up more avenues to listen and to understand, where our partner's at. And they also act as an encourager. They light a little flame of encouragement under the work we're doing to let our volunteers know that they are valued because what they're offering is bringing great value. Does that make sense?
Yeah, absolutely. Yeah, Alan.
Well, and we're also talking about with some of the partners we haven't been able to work with because we're all trying to figure out how to stay in touch when you can't touch. So we've talked about voter education, which is going to become a big issue, I think, across the country this fall. So we're trying to develop programs that we could use partners such as the services for aging, nursing homes, the libraries, to convey information, maybe bringing in state and local election chairs to talk about how do you vote absentee, what's it going to look like. We know there are a lot of changes coming, so we're going to try to use those partners to address something that we know will be very topical in the coming months.
Yeah, and I think you guys, and Bob, you brought up an excellent point, I think, about just AARP's ability to convene people, but also we have such an audience, and Facebook is a great example of that. With those Facebook chats, I'm sure you guys are seeing the same thing. You may not see so many people turning up live, but they're getting a lot of exposure over time and sometimes really quickly. And that's one of the ways that even if a partner is just figuring things out and you've brought them to the table to have that conversation kind of in a public space so that folks can hear about it, it's a real gift that we can give them because they may not have that audience on their own, or they may not, they may not even have the tools or the resources to bring that a quality conversation, out to the public space. And we're very fortunate to have the tools to be able to make that happen. So, yeah, Rebecca.
Well, when you say that, it makes me think about the converse being also true, where Pride has an audience of, they're a credible guide for the LGBTQIA community. Similarly, I just thought of another example because, racial justice, like we're having these interviews, we have our set questions, and all of a sudden it's like not just asking about COVID, it's asking about racial justice and equity and all of that. So that has become a new question that we weave into those partnership interviews. And what that has opened up with one of our African-American partners was they've been wondering, how do they keep reaching their churches? They were like, we haven't met with them in months. And so they suggested that we do something in partnership using some of our tools to reach them virtually and to deliver voter education. So sometimes it really just fits, with exactly where we're going. And other times it forces us to think creatively.
Yeah, as many times as we get frustrated sometimes with how much of a beast our organization can be because we have so much to tap into, or maybe so much process. After almost 15 years, I have never stopped being thankful for all the resources we have at our disposal, and knowing that we are really fortunate. When I came from government, I called it the land of milk and honey. I was like, we've come here where we have so many tools, and sometimes it just takes a couple of attempts to get to exactly what you're looking for. But and even then, if we don't have it in-house, we can often get it, you know, and by another relationship or by just a few phone calls. And that is just it's just a real gift to us to be able to bring to our partners in the community. And really for our volunteers, we were all kind of having a good laugh about that before we got started today, about how wonderful it is to be at AARP where we have so much to tap into internally. So y'all, how about it? Anything else that you want to bring to the conversation before we wrap?
Well, I think, Terry, you made a good point. The advantage of an organization like AARP is we work with a lot of nonprofits and government entities, and they're always starved for money. So they don't have the ability to do, like as Alan set up, the chocolate thing. You know, that there wasn't a part of their budget they could devote to that. So, but with AARP, you don't have that restriction. And it makes it so much easier to make things happen.
It does. It's so, the things that we think of as so simple. I mean, we said t-shirts earlier. Food was a biggie. I was a grant manager before coming to AARP, and one of the specific lines that we had in our grant was that we could not purchase food. So how hard did it make it for us to have a training when you couldn't buy food for people, when you needed to have them there for 2 days? You know, it really added a layer of complexity and just kind of stress to things. And so that is something that I've always remembered as I've worked with partners, is like, what's on your wish list that you're trying to figure out how to get done? Because we can often do it with almost like, you know, a tap of the wand. We can just go ding, there you go, here it is. It's so easy for us to do that stuff, and it makes us feel good too. You know, it's really nice to press the easy button for someone who saw a real challenge or an obstacle. So, well, this has been so fun. You guys have set me up for a fantastic Friday, so thank you so much for joining me. Anything else?
I just want to say it wouldn't be possible without our volunteers. There's no way that any of this, or without AARP, you know, it's that combination that's really giving us a big advantage right now. I'm so grateful for the relationships our volunteers have and that they're willing to work at it.
Yeah, I agree. And volunteers are my favorite thing about being at AARP. So thank you guys for joining me. Alan, Bob, I loved meeting you and hope we get to gather in person after all of the pandemic is settled down. And Rebecca, thank you again for helping set all of this up. You guys are doing great work. Keep it up. And thank you guys for listening or watching, and we'll see you next time.
Thank you.
Thank you. Bye-bye.